Good day and welcome to our webinar, Remote Patient Monitoring, Real Data, Real Time, Real Revenue. Good afternoon and welcome everyone. My name is Selena Williams and I am a Program Manager for Hybrid Solutions. As many of you know, Hybrid Solutions is Georgia's Health IT Center, and we have been assisting clinicians across the state of Georgia with federal and state incentive programs that promote interoperability through successful use of EHR technology. We are located on the campus of the prestigious Morehouse School of Medicine within its National Center for Primary Care. Our Executive Director is Carmen Hughes, and our Executive Medical Director is Dr. Dominique Mack. Our presenter today is Amin Holmes. He's with SensorMed. He's the co-founder and lead engineer. For the past 17 years, Amin Holmes has worked to help influence the landscape of the healthcare IT industry. Amin graduated with a Master's of Electrical Engineering from the Georgia Institute of Technology and also worked as an engineer at IBM's Research Triangle Park location. In 2014, Amin co-founded SensorMed Incorporation to be on the cutting edge of IoT innovation and value-based transformation in the industry. SensorMed has partnered with Care Medical to bring new insights to the home respiratory market for thousands of COPD patients. In addition to providing leadership to his startup company, Amin has served as a lead technical resource for the statewide Health Information Network of Georgia. Our agenda today is review RPM overview, discuss the reimbursements of RPM and telehealth, workflow tips, and an interactive Q&A session. I'll turn it over to Amin Holmes.
Okay, thank you, Selena. I appreciate that. Hello, everyone. I am, I'm Amin Holmes. I'm here to talk to you today about RPM, something that we deal with on a daily basis, and I have been for quite a few years. So hopefully I can share some information today that will educate, enlighten, inspire, and generate many questions at the end. So I've kind of structured things here to get the conversation going, give you some high-level information about RPM, some reimbursement things, workflow things, but I'm really looking forward to the questions at the end so that we can have a little more of like conversational dialogue around these type of services for the patients in your area. So let's start off at the high level. So we'll talk about what is RPM. So essentially, at its most basic level, it's the use of connected electronic tools to record information that's in one location and send it to a provider that's in a different location. So on the screen here, you can see a few examples of the type of devices we support, such as glucometers, pulse oximeters, scales, blood pressure cuffs. So just a sample of those type of devices. But also on a higher level, this is not, I don't want to make it seem like this is something new and never ever been done before, thought of. So I did a little research and I'll go all the way back to 1879, where there are articles that discussed using the telephone to reduce unnecessary office visits. Then also we could look at an example in 1925, where on the cover of Science and Invention, that magazine, they showed a doctor diagnosing a patient by radio. So this concept has been around for a long, long time of allowing the medical professionals to reach patients that aren't directly in front of them. And that this RPM wave is a new extension of that. And that is with the new technology, internet, reimbursement codes, that's what kind of makes it a little bit different now, but it's the same general premise that they were thinking about in 1879. It's, hey, there are people that are at a distance that still need medical help, and how can we get that to them? So let's talk about a couple of the high-level benefits of using RPM program. So if you have a lot of diabetics, then reducing A1C levels would be a good target for you. If you're a hospital, reducing readmissions is a good target for you. Also, surgery centers, post-surgical care, RPM and telehealth can be used to help with those services. Also, medication adjustments. This one we see a lot where in a typical, I would say almost traditional way of providing medicine, that a doctor may see you in January and they may not see you or ask you any questions until months later. So it may be June or so by the time they see you again. Well, throughout that time, they have no idea what's been going on. The medication they prescribed to you in January, they don't know if it's been working. There's been no feedback for them. With an RPM system, a program at that practice, they're able to actually see if the blood pressure medicine, for example, they prescribed to you back in January is working in February. They don't need to wait till June for you to come back and tell them how you've been feeling. They could see it on a day-to-day basis. So that way they can adjust medications and get you to what may provide better outcomes for you. Another reason for the RPM benefit for the RPM programs are engaged patients. So one of the things that we thoroughly believe in, and one of the big reasons that we wanted to be advocates in this space, is because we feel like patients, their care starts with them. So if there's a sense of ownership that needs to take place in order for patients to really maximize their health outcomes. And so remote patient monitoring enables the patient, it empowers the patient to know their own data. So it's not anybody else's responsibility out there to know what their blood pressure is. It's their responsibility. So it's not anybody else to know what their glucose levels are. It's their responsibility. They're engaged in their own health. And so, as I like to say, they're part of their own rescue. And I think that's where you're going to get the better outcomes, the quicker recoveries, the more stabilized patients, is when they feel some ownership. And in many cases that I've seen personally, that there are some patients that feel, hey, I'm just going to go to the doctor and she's going to make me all better. And as opposed to pointing the finger internally and saying, hey, I need to be engaged in my own health. I need to know my own numbers. I need to know what medication I'm taking, and not just totally just lay that on the doctor's office. So this is a really good tool to engage your patients and make them participate in their own rescue. This is an example of a study that we did with a local hospital down in Macon, here in Georgia. And what we did is track the readmission rates for people in a COPD cohort. So what they did was they used technology to record their status every day on how they're feeling. Are they taking their medication? Are they walking? Did they do their maintenance inhaler, or did they do their rescue inhaler today? And basically, by going through and making sure their health is on the forefront of their mind, we actually saw significant reductions in 30-day readmission rates for those COPD patients. So it was very eye-opening. I mean, it proved what we kind of felt already, but it was wonderful to have an opportunity with them to partner with Navicent and put that into play here in our local area to make a difference for those patients. So just more and more proof that it works. Engaged patients is more on their mind, and they may think maybe they weren't going to take their maintenance inhaler that day, but hey, I got to answer this SensorMed thing, and Navicent wants me to answer this. So then they go, oh yes, so I can say yes to this question. Maybe I need to go ahead and take that puff of my inhaler. So it's all a great difference there, and we're very thankful for that opportunity with Navicent. So there's another portion to this. So I talked about the clinical benefits, things good for the patient, but starting in 2019, it actually became a good financial model for practices and hospitals and providers alike to provide these services to their patients. So just as you would with any, if you're running a practice, any other type of service you provide that has CPT codes that are reimbursable, same thing with remote patient monitoring. So I want to just cover these in detail for people that have not seen these before or may not be aware of how these work. So the primary codes for remote patient monitoring are CPT code 99453. What this is a one-time billable code for the setup of the patient. So when they start the program, you get to bill this one time. The other codes are monthly. You get to bill them every month. So the next code is the 99454. So this is what I like to call the patient participation code. So if the patient participates enough, 16 days out of a calendar month, they don't have to be contiguous days, but it's 16 days out of the month, then you're able to get reimbursed for this particular code. So again, it is based on patient participation. So you would need to make sure that you're engaging the patient, making sure they're doing their readings. And if they do enough of them, then you're able to receive income from that. The next set of codes are 99457 and 8, where these are what I call the nurse participation codes. So the other one's patient participation. You get paid if the patient participates. This is if you get paid if the nurse participates. And I'm using nurse in a very generic way, but essentially a medical professional that will engage that patient for either 20 or 40 minutes over the course of that calendar month. So this is what we're used to, like patient engagement, following up, talking to them about their health care, reviewing their readings with them. And the example here of the $94 per patient is based on the 99458, which is the first 20 minutes and then a second 20 minutes for a total of 40 minutes. And as long as you do these things and meet these marks for the patients, if they do their 16 days, that's a billable event. And if you can document the nurse participation and their follow-up with the patients for 20 or 40 minutes, then you're able to submit reimbursement for those codes as well. And this is ongoing every month. So this is how, again, this has been since 2019, where CMS approved these, and now practitioners are able to actually make this a viable part of their, not just clinically, but also financially for their practices to expand and help as many patients as possible with chronic conditions. So I'll take you through an example from the financial side. Let's just say you monitor 100 patients and you're going to target doing 40 minutes on each patient for the month. So again, kind of as referring to the previous slides, and make the numbers, kind of round just to and round it down, of course, because we know reimbursement is not always exact. So, but just say, be conservative, round it down, make the numbers even. So you got $20 for the 99453, $50 for the 99454, and $80 for the 99457 and 8. So which would give you in that first month $150 for that particular patient. So as you can see, if you had 100 patients, that's $2,000 for setup time, $5,000 for monitoring reimbursement, and $8,000 for the data view reimbursement, which is the nurse time. So first month, $15,000, then every month, $13,000 after that for, multiply by 12. So you would yearly be looking at about $170,000 just for 100 patients on your monitoring program. And so what we typically do is we have milestones for our practices. And so those are like early milestones to get to 100 patients. But this keeps the numbers very round and easy for you to see. And you can extrapolate from there. If you have, 2, 3, 500, thousands of patients, then, it can kind of make a lot of money for your practice. So we did want to cover the financial side of it as well, because it's again, similar to any other service you may be providing for your practice. If you have an X-ray machine in your office that generates revenue, so you charge for using that machine. Same thing here. You have blood pressure cuffs out at various homes, you're charging for that service to those patients. So this gives you a round example of how you could get started with the RPM program. So we've talked about high level what RPM is, some of the benefits clinically, also some of the benefits financially. Let's talk about workflow a little bit. So we at CenterMed, we have a 5-phase methodology that we take every practice through. So such as patients, choosing the patients, going through consent, how to deploy the devices, how to do the analysis, and ultimately how to submit for the reimbursement. So we take everyone through these steps. And so if you are very meticulous about how you go about it, then you can avoid a lot of missteps. And so that's what we help people with. So for example, choosing a patient, you would want to do your insurance verification, of course. You will want to make sure this patient is bought into the program, like they want this, because a big part of the business model is they have to participate or you won't be able to get the reimbursement. So handing a blood pressure cuff, for example, to someone that's fighting against it would not be a good option. So we make sure that we train people on how to identify the right type of patients for your RPM program. Ultimately, it's supposed to be a partnership. You know, you're a patient that wants to get better and you're providing the tools for them to help themselves. So that's the part of choosing the patient. On consent, consent is required for reimbursement. So if you were to get audited, so just like they audit anything else, when you get audited for a charge you may have done under these codes, you're going to need to be able to show that the patient did consent to be in your RPM program. So we make sure that's a big part to get that checked off. Deployment is about how do you physically get these devices in the hands of the patient. So that may mean shipping them, handing them out in the office. It may mean shipping them directly to the patient's home. But deployment is one thing you have to think about. Analysis. Who's going to look at the data? When are they going to look at it? How often are they going to call the patients? There's a lot of a workflow to discuss there about your nurses, their responsibilities. Do you outsource the nursing? These are all things that have to be discussed. And then last but not least is billing. So how often you're going to submit for the reimbursement? How is it internal billing, external billing? And there's several questions that happen there, especially with billing companies that may have never submitted for RPM, but that we make sure to really cover that in depth to kind of tie everything together. So, but workflow goes pretty smooth if you think about it in these particular boxes here. And one last thing about workflow is that we make sure to track pretty much everything about a practice in their program, and we share that back with them because we believe that the more you're able to see the metrics and the data, you can keep things rolling like a well-oiled engine. So we let you know like how many patients are active, how many patients have devices they aren't doing anything with, so forth and so on. So I think that it's a big help to practices to let them know if they're succeeding or not with their RPM program. And our goal is to really get in there and help them with these numbers and say, well, let's get more patients, not just more patients on the program, but we need them to be active. So let's collaborate and find out what if more calls need to be made, or text messages, or automated robocalls, or anything we can do to try to get these patients engaged in their own health. So those are some of the workflow considerations when looking at your RPM program. And I believe that's it, the last slide. And I do want to open it up for Q&A to, like I said, I want it to be brief, touch on some highlights, and then ultimately have a discussion and ask the questions from the audience.
Amin, thank you so much for sharing your wealth of knowledge around the benefits and reimbursement updates on RPM. I really appreciate you sharing the case studies to give our audience practical benefits on using this product and how it can be impactful on a patient's healthcare. I have a few questions for you. Other than the case study shared, what positive impacts on the provider relationships and outcomes for patients have you resulted from using digital health tools such as telehealth, remote patient monitoring, and in coordination of patient care? Are clinicians and patients happy with the results of implementing RPM?
Yes. So there are a few benefits here that I can that come to mind. One is the bond with the practice we've seen, where patients really begin to rely on the RPM program, just from kind of like a security blanket. They know now the one thing I do want to make sure, and I did mention this earlier, is that RPM is not intended, billed as, or designed in any kind of way to be an emergency response system. This is not, someone expected to, sit there and watch the data at, 2 a.m. on Sunday morning, right? That's not how this is designed or intended. But it is for patients that are, have a long arc of trying to get better. And if they're trying to get their blood pressure down, they feel better about their relationship with the practice. And so that creates a stickiness with the provider's office where they know and they feel like someone cares enough to check my stuff every day. That someone's going to come to me if they see I'm on a bad track and they see my blood pressure is not going down correctly. So I think for patients, it's the security blanket. But for provider offices, it's also a business tool because it makes the patients happy to be there. It's a differentiator. So maybe their old doctor, they didn't have this type of tool, but they go to the new doctor's office and they do have it. And they feel like that makes them more, kind of brings the doctor into their home and makes them think about, that particular provider and that they care. So those are some of the big benefits that the offices take away when they implement a program like this.
Thank you. Yeah, I haven't used it personally, but I witnessed my mom, I assisted her with using it, and it was definitely beneficial with her having so many comorbidities, hypertension, and doing hers throughout the day. Her provider did respond proactively and followed up to ensure that, that they took the proper protocols to adjust her blood pressure. So it is definitely beneficial. We have a question in the chat. I think someone raised. So I'll just go ahead. She is obviously not working. So her question is, we have a patient who was not receiving hospice care when she was initially enrolled. When she started to receive hospice care, our claims were denied for patient being in hospice, even when we had added the modifier GW. Are patients in hospice care and skilled nursing facilities off limit to receive RPM services?
No. So we have seen patients that are in skilled nursing facilities, nursing homes. We actually have a very large client in North Carolina with multiple nursing homes that they're able to get reimbursed for their normal services in addition to remote patient monitoring. The only place we have seen there be some overlap and where things don't work is in FQHCs. So that's some type of some places where it doesn't, you're not allowed. It's kind of like double dipping. So those FQHCs are already supposed to be doing things like this with their reimbursement, so they can't, get reimbursed again for doing something they're already supposed to be doing, right? In general, so FQHCs is the one place we've run into some issues with.
Okay, and our next question. I'm just going to throw this question at you from a perspective as a provider practice. Clinicians are very busy providing care and are faced with many other challenges during the day-to-day operations. What would you say is the biggest challenge to implementing digital health tools such as telehealth and RPM?
Yeah, so the way the question started was hit the nail on the head. Is everybody's busy, right? Everybody's busy. So nurses have too much to do, front desk staff have too much to do, doctors running around. She doesn't have time to do anything already. So trying to squeeze in a new program is always one of the most challenging things. So, the short answer is workflow. So we have to work very closely with the practices to get this off the ground. Now, once overcoming that initial, the inertia there, then when it becomes a daily part of their job or the daily task or whatever they're supposed to do, then things go a lot smoother. But overcoming that initial hump of adding a new workflow step into the day of a busy staff is always the biggest challenge. So generally, if we have a very excited provider or, just really bought in to wanting to expand these type of services for their practice, that's what's required. If it's somebody that's kind of, and we've seen it all, like, that if it's somebody that's kind of like, well, yeah, I'll just kind of try it, it's going to be tough. Because if the staff can sense that lack of energy, and they're going to go, well, I'll get to it later. And then they're not going to get to it. But when we come across providers that see what this could do, and they see the case studies, and they, on the revenue opportunities, any of that, then, and they go with it to their practice with like, hey, this is great, we need to add this, and then they're on it, then the staff follows suit. So workflow is what we spend a lot of time on with our practices to overcome that initial bump there at the beginning. Because you go into most doctors' offices, they're running here, running there, grabbing things off the fax machine, on the phone. Doctors like signing things, going in and out of the doctor's office, rooms. So it's a lot going on. But I think that once we're able to get a provider that's really excited, then it makes a big difference.
That's good to know. And I think, like you say, workflow and just being consistent with following that workflow, because it is very busy.
And so I do want to add to that, like with the busyness. So as a part of, as you said in my bio, we've been doing this for over 8 years now. So we've seen a whole lot of stuff. And what has happened is that more and more of this has to be outsourced. So that's why we have like a bank of nurses. We do the shipping directly to the homes. We have people in tech support to train the patients on how to use the devices. So we even help with recruiting. We have phone systems that help recruit patients. So because practices are busy. And so we come across some practices that want to be very hands-on, and we come across some that want to be very hands-off. And they're saying, hey, we'll like maybe recruit the patients, but after that, we want you guys to take care of everything. So most of those workflow steps we actually do for the practices because they don't have the time. They may not have the nurse time to call patients 20 to 40 minutes. So we use our nurses. They may not have time to do the billing. So we have a billing team. So we just over the years have had to come up with and add more services to account for what you're mentioning here is the lack of staff time in some of these practices. But it works out. We're able to kind of a la carte, approach practices and say, how do you want it? Do you want us to do billing or not, nursing or not? Do you want us to ship to the home, to the office? And we're able to construct a workflow that's best for that particular office.
Thank you so much. And that's thank you for providing those tips and letting the audience know that you do offer those services, because every practice does not have the capacity. And that's good to know that you do offer someone to come out and do on-site training.
Mm-hmm.
We have Donna Austin, and she said, very enlightening information. Thank you, Amin, for the wonderful work you are doing. Do you have a methodology for patient participation? In other words, have physicians shared with you ways they were successful in increasing patient participation?
Yes. So we've actually seen a few different ways. We've seen some incentives in terms of like Starbucks cards, also like a raffle, for patients that participate. Also, perhaps the biggest thing that we've seen help with patient participation and engagement is the way the patients are recruited. So while we do offer like recruitment services from us, a third party, those typically are not the most effective because they don't know us. So they're getting a flyer in the mail, they're getting a phone call from a stranger saying, hey, don't you want to be a part of Dr. Brown's program? Well, they don't know us. But when Dr. Brown says, hey, I want you to be in my program, then, because it's coming from her, patients all in then. Like they feel more engaged and bought in. So what we try to encourage is for the message or the request to come directly from the physician that they trust. That's why they're in that office, because they trust that doctor to say, hey, this is what's right for you. And so if the doctor feels like that's a good match for the RPM program, and this will really help that patient, then that combo works really good for engagement. So, but we've seen, like I said, a few different things from raffles to, gift cards, periodically. The training helps the difference as well. So We've had some offices that say, no, 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 don't ship to the patient's home. I need them to come into the office. Let me give them the device. Let me sit them down, train them on how to use it, because I know my patients, like, they're going to need to see it from my staff. So that generally the way it gets started is what helps best with it, with the engagement. So hopefully that helps.
Thank you. I know you provided some information around the billing and the codes in your presentation. Is there anything else you would like to elaborate on more around the reimbursement and details? I know you mentioned how often the provider can bill for the RPM and telehealth services. Is there anything additional?
Yeah, so there's a
You'd
few
like to
things
add?
else I would bring up. In general, right, because this is still relatively new. 2019 is when they was just first anyone started reimbursing for it. So Medicare patients, or if you have a high population of Medicare patients, then you automatically know they're covered. So just nationwide, Medicare patients are covered. However, it varies from state to state and from payer to payer on what they cover. So, for example, there's like a military payer. It's around some military bases in Florida that they didn't cover it, and so that particular commercial payer didn't cover it, even when the pandemic started and the public health emergency was declared by CMS, which said that everyone has to cover RPM. Like every payer has to pay on these codes.
Wow.
Well, but they don't tell you how easy you need to make it. So they're like, yeah, we'll pay for it, but you have to fill out 5 sheets of paper first. Then what the office wants to do that. So that's the kind of cat and mouse game we've seen from some payers that don't want to pay for it. They'll say, yeah, we cover it after you jump through these hoops. So, and then in practice, it just go, never mind. And, but so generally, we tell practices to get started, focus on your Medicare population. They'll be covered, from a reimbursement standpoint. And then in certain states, we may have some information we can share with you, like, okay, Blue Cross Blue Shield does cover it in this state, and they cover it to this amount, or maybe Cigna does or doesn't, but it varies from state to state. But if you have Medicare patients on your rolls, then you'll be fine.
Thank you. So we're going to jump around. We're going to kind of move on a little bit about Hipaa. I know a lot of patients and providers are concerned. There's a lot of data breaches is a huge concern with these type of devices. So I know they say you have to vet the vendor, ensure that you're going with the right vendor. So how can you ensure your RPM program is HIPAA compliant? Do you have any feedback on that?
Yes. Yeah. So just to give you an idea of kind of how the data flows, the data coming from the patient is anonymous. So think about it, you're taking a blood pressure reading and it doesn't have your name on it. It doesn't have your address on it, your social security number, your MRN. It's just, your blood pressure is 120/80, send it. So coming into the servers, then that information does not contain PHI. So I want to make sure that most people are aware of that as you're using these devices, it's just numbers. The only time where you begin to get into some HIPAA questions are when you tie that with some personal information. Mm-hmm. So, because imagine if someone stole that out of the air, right? Just over the internet, stole that information before it got to us, then they don't know who that's from or where they got that. There's nothing they can really do with that information. Now, what we do, and this is why we are very secure, is that that we marry that patient information with the medical information, and that's where it becomes protected. And so, one of the things you would suggest is to ask the deep questions from your provider about the data being encrypted at rest or in transit. Ask about log in, and log out functionality. So, does the system kick you out after a certain period of time, which is required for HIPAA compliance? So where's the data being stored? How long is the data being stored? So these are some key questions that you want to make sure to ask your provider, your vendor, about how they treat the data and how they move things around. But one prime example I'll give, and I know this is a rub because it's really it's a common practice in a lot of offices where you share passwords. That is explicitly against HIPAA. Like that is, you're not supposed to share passwords. So that's one of the things that when we bring on someone and we're training them, we get that question a lot during training, and we press them though. We're like, no, everybody needs their own ID. This is not, we're not going to create a general office ID for you guys. This needs to be, everyone has their own ID so that you can activate and deactivate people as they come and leave the organization. So it's things like that. And you can tell when you're having conversations with your vendors, if they seem very lax about things. For example, another example might be, hey, I'm just gonna email you this patient form. And no, not secure email, not encrypted email. I'm just going to regularly just email it. Well, if your vendor doesn't push back and say, whoa, hold on. You can fax that maybe, that's still okay. Or maybe you can upload it securely somewhere, but I cannot have you just plain no encryption emailing a patient's name and their participation in this blood pressure program to my email. So if your vendor's not pushing back on things like that, then they're obviously not paying attention to the HIPAA rules and regulations. So those are just a few tips to help with kind of vetting your vendors when it comes to remote patient monitoring.
Thank you so much. So it's very important to vet your vendors, ask those questions that Amin just mentioned. Okay, we're going to go back. The question around hospice, do you have advice on how we can get reimbursed for our hospice patient? The previous question that they asked on around the billing for hospice. If you can drop your email address in the chat or in the Q&A, we can also reach back out to you if Amin is not able to answer that question at this moment. We can reach back out to you with some information. But Amin, did you want to elaborate on that?
So my general answer to those type of things is pre-verification, just like with anything that you do when you bill against insurance. There's typically a process that you have to make sure that the insurance will pay for that surgery or pay for that medication or that X-ray or whatever it is you're asking the patient to do, or that service you're going to provide for that patient. Just like you typically would check to make sure you're going to get paid for that, same process. Here are the CPT codes. You call the insurance company, you log into their website, or some EHRs have that built in to your EHR to check certain CPT codes to see if that patient's insurance will pay for it. So that's my recommendation with those individual patients. I guess at the very basic level, pick up the phone, call the number on the back of the insurance card, tell them the CPT codes you want to charge for, and then they'll look it up for you.
Okay, thank you. I don't think we have any more questions. I just have one final question for you. The future of healthcare will continue to accelerate towards technology driven by virtual care models. What do you think is the future digital health tools in patient care? You foresee anything coming in the future? No.
Oh, yes. So I feel like one of the reasons that we actually began to feel very encouraged by this particular space is because of the convergence of low-cost devices. And with the fact that you can get like a high-quality device under $100 now, whereas before it was several hundred or even in the thousands to get a good medical device. So as that price kept coming down, along with the pervasiveness of the internet, so now you have remember we had 3G, and then now we have 4G. Now we have 5G. And so, like for example, with us, all of our devices are cellular enabled. So as technology continues to evolve, then those chips get smaller, and you can put that into a pulse oximeter. You can put that cellular chip into a blood pressure cuff. And as the prices come down, right? So we just see that continuing, even more and more devices being able to get out into the mainstream and for prices to come down, which means there's even more patients that can be monitored. In a longer term sense, I do think in the Web 3.0 space, where like virtual reality things. Just as I talked about earlier about back in 1879, they're talking about using the telephone to reduce visits, or the 1925 example about using the radio. So same thing here is that you'll be using your virtual reality glasses to talk to your doctor, and they'll be asking you questions so you can have kind of somewhat of a realistic experience. I think that's a ways off, 10, 15 years maybe. But I mean, those are we're always in healthcare IT, especially looking for ways to kind of fill some of these gaps. And this in RPM, this specific gap is the example I mentioned earlier about January to June. So what's happening to the patient? So and we're on the MSM event. So I'll share this bit that I actually got from Dr. Mack. So I was at a conference, I think it was HIMSS conference. He talked about patients, and after they leave the office, he used the term that they're free-range humans, just like free-range chickens, where you let them out and they just go. So same thing with the patients. Sometimes are free-range humans. You let them out of your office and they just go. You don't know what they're eating, if they're smoking or not, if they're eating bad stuff for them, if they're going places they shouldn't go for their health reasons. You have no idea as the doctor of what they're doing. And so RPM looks to kind of fill that gap a little bit. And it looks to say, okay, hey, now I know a little bit about what they're doing. I can see their blood pressure. I can see their glucose numbers. I can see their oxygen went bad, 3 days ago. So now you can say, well, hey, what happened, last week? And they may say, oh, I was getting stressed out, or, I ate something wrong, or, so, and these are the little, they seem very small, but it can be very powerful for individual patients, because maybe they didn't know that food would react to them before because they weren't measuring their stuff every day. Now they see when they eat that particular dish that has all that salt in it, yeah, their blood pressure goes up.
Yeah.
So before they didn't know that. Or when they would forget their medication or take the wrong medication, maybe their oxygen numbers go lower. So that one small decision could make a life difference for a patient, to just be informed about what their body is saying. And that's why we feel very just energetic about what we do for patients every day, because we feel like we're arming them, we're equipping them, we're empowering them to have their own data. And so they can make their own decisions. There's no doctor over your shoulder saying, hey, put that salt down, right? It's that blood pressure cuff told you need to put the salt down.
Yes.
So, and they're making their own decisions for themselves. And so ultimately, on the macro level, what it does is it helps, it's going to help bring down the cost of healthcare here in the United States. So, because right now we spend a lot of money for not great results. So that's why the billions of dollars that CMS is kind of influencing are being shifted more and more to value-based care models like this, because they're seeing that, hey, the way we've been paying for healthcare is not working. We don't need to wait till you get sick and have an episode and an acute event to pay somebody. Because then think about what that incentive is. The doctor thinks like, well, I only get paid when they're sick.
Right.
So do I really, go out of my way to keep them healthy? Like, where's the incentive there? So now CMS is actually paying the medical professionals to say, hey, keep them out of the office, keep them healthy. Don't let them have an episode, change their medication so they don't show up to the emergency room. Mm-hmm. And so, but at the same time, it's a business. Healthcare is a business as well. It's altruistic, but it is a business. So in order for the hospitals to stay open, they have to have some type of reimbursement to offset that, right? If you have fewer people coming in, then where are we getting our money from? Well, we're checking blood pressures. We're keeping them healthy at home. So, and I feel like to kind of go back to what your question was, the future is, I think, this getting that loop tighter and tighter, meaning that maybe now we're looking at the food that they're eating, and not from a bad standpoint, but it's a helpful standpoint. And it just depends on perspective. But some patients appreciate someone knowing that, hey, you should not be doing this. You should be doing this. Let me help you. And so I think that as more and more devices come on the internet, come on the industry and be available, then offices and hospitals will start to employ these insurance companies. We have insurance companies that we work with. And they, of course, as you can imagine, they have a big stake in making sure patients stay healthy because it costs them less, if the patient stays out of the emergency room. So it's a win-win, right? I don't want my mom in the emergency room either, and they don't want her there either. So let's work this out. Let's get her, a pulse oximeter, make sure the oxygen is fine, and try to catch it before she heads to the emergency room or calls the ambulance, right? So that's really what we do, and I do see that the future being more devices and closer monitoring, and I just see a bunch of empowered patients being just in charge of their own health. So I'm excited.
Thank you so much, Amin. And around that, you're talking about patients being responsible and empowering patients. We have one of our providers that is interested in RPM, and I thought was very interested as working with her in the DPH project around hypertension. She has audible books that she gives her patients. She has exercise sessions that she do on campus at her practice to kind of encourage patients to, take control of their health and be responsible and be engaged and be active in their health. And I think that is a good way to kind of give back and encourage patients. Thank you so much. You have given us a lot of information around telehealth and RPM. I don't think we have any more questions. I'll move on to the next slide. So we are in partnership with ForMed Approve for online education and training. It's designed to meet the needs of busy healthcare industry professionals by providing its members with discounted training, continuing education, and professional development opportunities. Training is approved for RNs, LPNs, physicians, PAs, clinical providers, consultants, managers, technology professionals, and veterans and others. So if you're interested, we have that information. Our contact information is at the end of this presentation. If you're interested in any of our courses, reach out to us. You get a 20% discount. That concludes our presentation for today. Thank you again, Amin.
Thank you.